Good afternoon, Professor. This is my fourth assignment of Electroceuticals, and today's topic is about deep brain stimulation for movement disorder other than Parkinson's disease. And yes, start with the uh, abstract. In this, DBS is also a beneficial treatment for Parkinson's disease patient. But now the Parkinson's plus disorder, in the treatment of diacetyl, the common target is internal globus pallidus, which is GPI, and focal and generalized primary dystonia, which is respond extremely uh, bilateral, and the most modernist improvement has been seen in management of secondary dystonia in the treatment of essential tremor and vital VIM or ZIDBS is very effective, and target is ventral intermediate nucleus of the tamals or the zone in Creta, and sometimes it is used to treat the throat syndromes, chronic myoclonus and Dravet syndromes, and result is often seen this other condition, although further research is needed to clarify which patient will be benefited with such treatments. And next come the introduction part. In this, the group of neurologic conditions which impairs the control movement, and which is associated with hypokinetic disorders and pathological reductions in the movement, whereas hyperkinetic disorder associate with the pathological increase of in movement. As Parkinson's disease is most common hypokinetic movement disorder, and the main clinical features of this disease is resting tremor, getting stiffness is there, and buried kinesia and slowness of movement. And in this, DBS is used in treatment of Parkinson's disease for somewhere very effective, and uh, many patients, and this disorder present in similar fashion to tumor titicte and Bardet Kinsenia, and this plus disorders do not usually respond well to the Leonpoda and other antidepressant therapists and tend to progress, and this disorders progress supranuclear nuclear spelsis and multisystem entropy and corticosbella degeneration. There are several different type of hyperkinetic movement disorder, which as incron dystonia tremor and myoclonus and index movement. In incron, the involuntary movement are random in nature, and in dystonia the movement are patterned, and tremor the movement are rhythmic in pattern, and myoclonus movement are very brief, and in tics the movement are superficial and associate with underlying the urge or sensation. And this is the table about this comparison table about Parkinson disease and Parkinsonism, and symptom is main monitor symptom is like tumor and limb rigidity and bagidry, same as in paroxysm is tumor symptoms is tumor limb rigidity and back battery kinesia, and the other symptoms may occur as non-motor symptoms uh, is like conjunctive changes and depression, anxiety, empathy, and sleeping problem, swallowing, chewing, speaking difficulties, and urine or constipation problem. And in paroxysm, the other form is like MSA. This is multiple system entropy, progressive supranuclear palsy, and Cortry-Bessel syndrome, demental with bodies, and drug-induced paroxysm, vascular paroxysm. And I have also mentioned the reference which I have from where I have got this all point. This table is about the DBS of treatment of movement disorder, other paroxysm disease. First column is about movement disorder and the specific condition and what are the effect of this DBS. So one of the movement disorder is in Parkinson is PCA and MSA and CBD has specific condition, and it affects little benefit of traditional DBS and some interest in possibility of PPN sorry of PPN and DBS for PSP, although results shows the modest benefit at present. And Toronto syndrome is modernist efficiency of DBS in small studies varies, and it affects the targeting including GPI, GPA, and Thymus. And in myoclonus effect, it has a good result of myoclonus district, which is a bilateral GPI and DBS. So I have explained some of the point, and this slide is about history of DBS. And in 1980s, Oliver and Choclet developed the three-dimensional coordinate system stereotactic device, make the atonalic defined lenses in the brain of monkey. And in 1947, Spargil and Vigis has developed the stereotactic surgery in humans. And in 1965, stereosurgical gradually become very popular. Around 25,000 stereotactic operation has been done in treatment of various neurological conditions, including the movement disorder, pain, and aphasia, as well as the treatment of psychiatric disorder. And next is in the leg cell frame uses arc system, which allow the carrier to move along the arc to any location and still be able to terminate at desired target. And the center of arc indicate the desired target. Any part of brain can be accurately target by using specific condition system. Prior to the surgery itself, an image is taken to the patient with the frame in situation. This is topic about techniques of surgical getting lead to the target. For some surgeons perform MRI during DBS surgical process, and another technique is MRI scan prior to at the surgery. To the surgery, on the day of surgery, frame has been attached. CT scan is performed. Frame has fiducious with the vision of CT scanner, and it then diffused with the preoperative MRI location. And once the computer software is identify the coordinate, all the coordinates of that, then the surgeon drills the hole in the skull and passes the DBS lead to the desired coordinate, checking that the target location has been reached. Several different ways of surgeon can check the lead is now lying appropriate target structure. First method involves the micro electrode recording from the lead during the last millimeters from the approach to target. Second method is determine the accurate location that leads require walking patient up during the surgery. And third, to determine the accurate location that lead require post-operative imaging. This topic is about programming the deep brain simulator. Teaming the simulator programming. The impact effect often lasts few weeks and complicates simulator programming, and and it's although not all the units wait few weeks or after surgery before switching the simulator. Initial programming session take between 1 and 3 hours depending on the number of parameters programmer need to access. And the main aim of initial programming session is to work the most effective simulator setting for the patients. And selecting the best configuration contact is like nowadays most commonly simulator system is Medtronic system and Boston and SD system are most frequently used. This Medtronic 3389 leads commonly used at a time of writing, and lead has 4 contacts. There are contact. These contacts are 1.5 mm long and spaced 0.5 mm interval. On the left lead, the contact are labeled from distal to proximal 0, 1, 2, 3. On the right lead, contact are labeled from distal to proximal 8, 9, 10, 11. Adjusting the simulator parameter. Pulses of simulation are applied at every fast frequency with defines duration of each pulse. Size of each pulses and frequency determines how many pulses are there as per second, and frequency measured in hertz. And also varied low frequency simulation, which is less than 50 hertz, is generally not effective for most movement disorder. And this is the frequency and pulses after every per seconds, and the impedance is equal to voltage upon current. And this topic is about Parkinson's pulse disorders. In this, it caused by features including tremor, rigidity, and badrixenia. Although a typical Parkinson resting tumor is rare in Parkinson's pulse disorder is usually progress relatively towards severe disability and subsequently death, and median survival times are much lower than the Parkinson disease. And this disorder is much more widespread neurodegeneration in the basal ganglia, and which may be main reason why they do not respond well to the Leopoda or DBS. The main disorders of this are the 3 main pulse disorders: MSA, PSP, and CBD. In MSA, automatic symptoms and serial Bellera systems are common, and PSP patient develop impairment of pollination eye movement, and CBD patient often present with paroxysmal disorder of higher motor control and myoclonus and uh, and in the limb as well as paroxysmism. This was the last topic of this assignment, which is dystonia. It's about dystonia, and is a hyperkinetic movement disorder which increase in involuntary movement in pattern. And what is dystonia is a characteristic by painful prolonged muscles contraction that result in abnormal movement and postures, and is one of the classification has that the general dystonia is has leg, trunk and other body part are affected. In hemiostenia, the limb down one side of the body are affected. In segmental dystonia, two neighboring body parts are affected. In focal dystonia, only one body part is affected. Neck cervical dystonia causes the neck to develop abnormal posture. Eyelid is they tend to forcefully close, and when so, the patient can functionally blind. Limb is the lower limb which may develop unusual posture of walking, or upper limb which may develop unusual posture of, for example, when writing. And mouth and jaw can tend to opening or closing when eating or speaking, and larynx is affected, often causing straight diagnostic speech. So this is the end of the assignment of my electroceuticals. I have learned a lot with uh, studying and while making and studying about this topic, which helped me in further, which is very having great knowledge about more deeply about neuroscience and other DBS disease also. Thank you for this assignment, and thank you so much.